Good morning, everyone. Welcome back. If you care for an elderly parent or loved one, it's important you know there is an emergency care just for them here in San Antonio. Kristen Lemus is the Chief Nursing Officer at Northeast Baptist Hospital, and she is here to tell us more about their senior ER, which is so cool. I didn't even know there was an ER just for seniors, but that's wonderful news for people.
Yes, it's something that we are the first in Baptist to have a senior ER, and what we've done is we've specifically tailored this ER around our elderly patients.
Okay, so if somebody is, let's say, caring for an elderly parent or a grandparent, they have an emergency or any issue, they really should be coming to you first because you are trained specifically to take care of elderly.
Yes, all of our staff have had, as well as our physicians, have had training for that geriatric patient, for that elderly patient. So we are the best in San Antonio to take care of that patient.
So give me an idea of what type of training that your staff goes through in order to specialize in this.
What we did, some of the training that we went through is we had some of our staff, actually all of our staff that are working in these departments, go through the taste. They simulated tasting as an elderly patient would taste, seeing as an elderly patient would see, as well as hearing as an elderly patient would hear. So
that makes sense, how you would communicate with them, which seems simple, but you want to make sure that they understand it is different with an elderly person.
It is so different for an elderly person, and all their senses decrease as they get older.
And we forget that sometimes, don't we? When everything's working fine for us, it's easy to forget that it's a little harder for them. Now, what are some of the unique features that the senior ER offers? And also ACE, which stands for Acute Care for the Elderly, right?
Yes, our senior ER is away from our main ER, so it's away in a quiet place in our emergency room. It has 10 beds. It is there's non-skid floors, as well as optimal lighting for our elderly patients.
Now, is this somewhere that people would just be taking an elderly loved one if there were an emergency, or could you bring them for something else? Can they see their doctors there? What primarily are the reasons that people are coming to see you?
Well, they can bring their elderly family member into our emergency room, and then we can transition them into our acute care for the elderly unit. That unit specializes in that geriatric patient also. And what we want to do is make sure that our patients return to home or to a setting where they've come from without having that functional decline that we see in a lot of our patients in the hospital.
Can people give you a call if they're at home and maybe they're not quite sure if they should bring in a loved one or not? Is there a number that they can call and you will say, yes, bring them in now? Or, is there a line available?
Yeah, we have an information line that we have available to the public, and it's, I know that we have.
Oh yeah, we can get that to everyone later.
Great.
But specifically, can they specifically call you is what I'm saying?
Absolutely, you can call me at any time. My number is absolutely available. I have a welcome letter that I put in every packet for everybody that comes through our hospital, and I do receive calls often for any type of matter, any concern that anyone has.
Okay, well that's good to know, and it's so wonderful that this program is here, that this location is here for people, because it's very stressful when you're caring for an elderly loved one, and a lot of things happen and you don't really know what to do. Well, now you know exactly where you can go. And that is to see them over at Northeast Baptist Hospital. So here's all the information right here on the Baptist Health System. You can give them a call anytime, 297-7005, the website baptisthealthsystem.com. You can also find them on Facebook, and they're on Twitter. And again, the senior ER at Northeast Baptist Hospital. They are there, and if you need them, if you have an elderly loved one who needs some help. Thank you so much, Ms. Kristen.
Thank you so much.
Okay.
It was a pleasure.
It was nice to meet you too.